So when it comes to doing some banded hip distractions, one of the areas that we sometimes feel or see some issues is actually in the front of the hip here, and it's as a result of that ball and socket kind of impacting, not just upwards like in this direction, but sometimes medially it kind of comes across too much and it feels like a little bit more pinching in that groin. But to help that, what we can do is we can get inside that band here and we can sling this right across the adductors on the inside of our leg here, okay? So you can kind of see this kind of in this position, and then what we will do is we will walk this direction, right? So as you can see, this is kind of pulling it apart, and what we can do is kind of just go through some gentle mobilizations. Now we can also do this as it's on the downside, right? We can also do it on the upside. I really like it more on the downside though, so once we get in that position, we can see the hip is being traction that direction, and we may change our angle, not only going front to the side, and then also we may want to do a whole runner's type of pose in this position, and then we will pull this up higher up into the groin, maybe into this type of position where we're coming in, we're mobilizing in this direction, and we're changing angles depending on where the pinching is in our hip. And then if this also hurts, we may want to put a towel or something underneath our knees or something like that to help support this whole chain here. But this is a fantastic exercise to create some gapping and some mobility within the joint complex, and at the same time you add some muscular involvement when you add that mobilization. So great for those people who have some hip pain, and it's really effective. Hey guys, today I'm going to show you a banded hip distraction, and this is going to be really great for those people who have femoral acetabular impingement. Maybe they're having some front groin or anterior hip pain or front of the hip pain. This also helps to traction not only the hip, but the SI joint and the lower back, and it just feels amazing and it's very easy. The only thing you're going to need here is one of those big thick bands, and then what we'll do is we'll tie it to a rig. So just like this, we're going to rotate it and we're going to pull it through the hole, and we might have to just get a little slack on there, and it's pretty easy. So now we have this nicely secured to the rig, and what we're going to do is we're going to place our foot right through here, and we're going to put it up really high up into the groin, right? So what we want to do is pull, get it high up in the groin, almost like coming across here, and then you can relax here, okay? You may want to hold this in place, and then to get this to create some tension and pull you down, what you can do in this case is shoulder walk back, okay? So as you can see, I'm shoulder walking backwards here, just into this direction, and I can just hang out here. And so what's happening now is the band is pulling back downward, and I'm getting a traction therapy not only to my right hip, but also the SI joint and the lower back. And just to get some therapy, you might want to wiggle a little bit side to side. You might want to just relax. If you need more attention, all you have to do is continue to wall walk or shoulder walk all the way up. And you're going to just hold this here for maybe 30 seconds to 1 minute. It should be really comfortable, and you should be able to do that approximately 3 to 4 times, probably doing this several times a week in order to help your anterior or your hip or lower back pain. But this provides an amazing amount of traction for the lower back, and you should give this a try. So to take a little pressure off of the hip joint and to help mobilize it into external rotation, which is this type of position. So maybe you're somebody who is stuck in this position, you don't have that good external rotation of that hip. What we could do is we can create some hip or gapping within the joint of our hip. So what we'll do is we'll grab a band, we'll grab it really high up into the groin, we'll pull it up towards us and get this slinged up across the groin, and we will shoulder walk all the way back until we feel that traction coming down. Now, if you want a little bit extra tension, you can just shoulder walk a little further back. Now, what we'll do here is we'll take our leg here, and we're going to cross it over the opposite leg, just like this, right? And you can just let that relax a little bit. Now, once you're able to get into this position, what you really want to do is not only let the band do the work, you're not trying to provide any resistance. Remember, this is a joint mobilization. But what we could do here is do some anterior and posterior pelvic tilts. Just coming off and back. And as you take an exhale or drop your pelvis here, what you will notice is you'll feel that traction going down. What's really great about this is that it helps disassociate or helps use the abdominals independently of the pelvis, and as a result you get a dropping or more of a traction sensation onto that external rotation. So this will help the joint capsule to externally rotate in this direction. So you should try this, be able to hold this for a few sets, maybe 30 seconds without any hip pain, and then if you're able to do that, then you could just go through the ranges of motion of the pelvic tilt. If it's not enough, just shoulder walk back, and the more you walk back, the more pressure you'll get down as that hip or that band does the work for you. But this is a fantastic exercise, and I'd highly recommend you give this a try. So one of the most common ways that we see impingement or issues within the hip is in the internal rotation. And internal rotation would be when we do this, right? A lot of people will get some pinching across the hip, and sometimes it's more of a joint issue than it is a muscle or a tendon or a ligament issue. It can also be some of the ligaments that are tied up around the actual hip joint, but a lot of people don't have the mobility within the hip joint itself. So what we're going to do is show you an exercise that will do that. So with the banded hip here, or banded hip distraction, we're going to pull this deep within our groin, right? And I'm going to show you actually on this side so you guys can see a little easier. We're going to pull this high up on the groin, just like we've shown you in the past, and we're going to toe walk, or shoulder walk I should say, and we're going to let the band do the work going downward. Now in this position we will grab a stick, a pole, a baseball bat, whatever you have at home, and we're going to hook on the outside, and then we're going to hook it on the heel. So right, you can see how we hook it on the heel here, and what we're going to do is we're going to drive that internal rotation. We might support a little bit at the knee and hip here, and then come back. Drive the stick this direction, be careful on the knee, and just mobilizing back and forth. It's not about how far you can get, it's really more about getting the joint to move freely, and then repeating maybe 5 reps, maybe 10 reps, while it's in that distracted position. Now, if you're also in this position, you may want to do the opposite, where we put the stick on the inside and hook the rotation, the heel on this side, and we might frame here and do some external rotation, right? So that's external rotation of the hip, and then on the inside we have framing here, internal rotation of that hip. Remember, it's about getting the joint to move freely, and it's not about forcing this type of motion. It's about getting that hip joint to move and slowly increase its mobilization through the joint, and not trying to force it, because this is a joint mobilization, not a muscle, okay?